Hello and welcome. My name is Yael Avnon. I'm a naturopathic doctor. I developed Biognostica method and Biognostica software, which I'm going to introduce to you in this video. The software is suitable for the use of doctors and other therapists with the purpose of creating high-quality level of diagnoses and treatments during a fast and effective process. The therapist enters the patient's medical data, including lab tests, and after only few seconds, the system generates the diagnosis result and the whole treatment plan, including personal guidance of nutrition and instruction for the use of supplements and herbal remedies. So, let's begin and see how the system actually works. First, we go to Patients List to pick a patient here or to add a new one. I already chosen one and it appears here up. After that, we open the health questionnaire here. I already entered a questionnaire, so I will open it like this. We start with the symptoms of the patient. So I already entered few symptoms. We can add a new one in this windows that opens with many symptoms to choose from. So we can choose another symptom. We can press this button and we can see explanation about the symptom. Pressing this button will show us the connected symptoms that we have for the specific disease that we chosen. Kidney stones have associated symptoms like blood in urine. So we already have blood in urine also here. And the therapist can write comments here. After that, we go to medications. Here we insert the medication that the patient takes. I will choose the category, blood pressure, and we can see different subcategory. So I will choose ACE inhibitors and I can choose the name and add it here. Pressing here will give us the explanation about the medication. Pressing this button will give us a list of symptoms that the patient has that are the side effects of this medication. We have hair loss and general fatigue that the blood pressure medication can cause. After that, we go to supplements. Here we fill the nutritional supplements that are taken independently by the patient. We can see here a list of supplements to choose from and to add for. I already added the vitamin C. We can see explanation about vitamin C here. We can see dosages of vitamins or minerals that are inserted here. We can see sensitivity for different supplements and we can put it in this section, and difficulty in taking supplements like pills or powders or fluids. If the patient has difficulties, we can press here and the system will take it under consideration. After that, we come to nutrition and lifestyle habits and we can specify about sensitivities or intolerance and nutrition. We have here a list of foods and we can erase the sign if the patient is not eating this kind of food, and the system will take it under consideration. Also here we can enter the amount of alcohol, water, coffee, physical exercise, all habits that the patient have, and the system take it under consideration for the diagnosis process and the treatment plan. After that, we go to surgeries and medical tests. We can fill each surgery by picking a surgery from this list. We can press the information button to see the explanation about the surgery. We can enter different medical tests. I already entered Helicobacter pylori test, and we have many tests here, allergy test, CT, MRI, colonoscopy, gastroscopy. Everything is written here, and we can describe here the test results. After that, we click here and we put the family problems here and abnormal blood tests that the patient has. We can choose it and put it here. And if the patient has already done blood tests, we can press here and fill the blood test that the patient already has, so the system will not give the referral to do these tests. Here we can write comments, and we can have the summary of all the tabs in one place here. We can see everything written here. And that's it. After that, we go to referral to blood tests. The system provides a referral for the patients with the list of blood tests to perform according to the information in the questionnaire. So we press this button and this one, and we will see the list of blood tests that the patient should do. Here it is, the list. When the patient comes back with the results, we go here, blood test entry, and we put all the blood test results inside this section here. We can see the list of blood tests here. I already filled it, so we can see the level here. We can put the results here, and we have many blood tests here in this list. We fill every blood test results. We have different categories here: blood count, vitamins and minerals, thyroid gland. We can see here the different categories. After filling the blood test, we go here to blood test results, and we can see here, I will choose the date. We can see the results in one page for the therapist to come here and see the explanations of all the results. When he presses here, he can see explanation about high urea, and he can see the associated symptoms here with high urea. This patient has kidney stones and gout and heartburn and hair loss, and here we can explain about the connections between the blood test and the symptom. Uric acid, we can open and can see here the connection between high uric acid and the symptoms, and another blood test between uric acid and urea. We have a connection between these two tests, and also the patient is taking vitamin C, and there is a connection between high uric acid and consumption of vitamin C, and that is described here. The therapist also can see an explanation about the blood test, pressing this square button, and an explanation will appear about uric acid. We have all this information for the benefit of the therapist. After that, we press the complete treatment plan button, and the system will create the reports for the client, and this will be saved automatically in this section, documents for the client. And we can see here the different reports. Let's open one of them, the diagnosis report. Here we can see the explanation for the client, and we can see the whole blood test results with explanation divided for the different system in the body. We can see here everything. After that, we can open the dietary supplements guidelines and we can see here the recommended supplements for this specific client. We can see the name, the company, the quantity, how much to buy for how many time. Now here we have the explanation about the supplement and the symptoms that it treats in this specific client and the blood tests that can be treated by this supplements. And we can we can see here the list of the supplements, and here we have the order of the supplements to take in the breakfast, lunch, dinner, between meals, like that. Here we have the nutrition report. We have recommended foods for these specific clients with doses and frequency. Here we can see the whole list, very organized, and then we can see the foods that are recommended to reduce in this case. So we can see here, and below we can see the menu options, like that: breakfast options, lunch, dinner, and between meals. The therapist can change the decisions of the system by clicking here in the supplement area, and he can come and change and replace supplements, delete supplements, enter a new additional recommendation of supplements here, choose supplements from this section here by the symptom or by a category: antioxidant, digestive enzymes, fatty acids, and etc. After 3 months of treatment, we fill a new health questionnaire and a new blood test, and the system creates a blood test comparison, and we can see here the comparison here divided for in different systems with explanation. We can see the result in test 1, the result in test 2, and the improvement here, the explanation, and in each different test results we can see the improvement, or otherwise if it's not getting improved, also it will be written here, and we can see the whole explanation in the comparison, and we can see the summary here and the whole improvement data. According to the new information, the system creates a continuous treatment plan for the next additional 3 months. And for the last part, we can see here the database. We have information about laboratory tests. We can see here all the blood tests available, and if we will choose a blood test, we can press it and explanation will appear on the right side. We can see the explanation about hemoglobin, and for each test we have explanation here. We also have questions and answers for the benefits of the therapists. They can come here and learn about the method and how to use the system. That is it. Thank you for being with me, and goodbye.